But actually, that's not what we saw. Consistently, the research has shown that simply providing more inputs like infrastructure and laptops do not improve learning outcomes. There's so much else that has to be considered for those things to be effective. So we're quite confident that that and that alone is not effective. Similar with microfinance, so it was not the magic bullet for poverty that we previously thought that it was. Again, with the smokeless stoves, even though the stoves were giving to these individuals, some of the studies that were conducted showed that they did not improve health because they were not being used and not being maintained. And then again, with the biometric devices, it didn't actually solve the problem of absenteeism. So the question remains, from that, we've seen that instinct or intuition isn't always right. So the question does remain, how do we address this dilemma that we face as decision makers? The dilemma being we have limited resources, but we have many challenges and many potential solutions. So how do we resolve this dilemma? Let's take an example to think through this. So let's say, for example, you want to improve school enrollment and attendance. Should you focus on demand side? For example, there's a lot of evidence around how improving children's health in school or providing information on benefits of schooling, as I said earlier, have been effective in increasing demand for education. Should we focus on those? Or should we focus on the supply side? So we also have a lot of evidence around the efficacy of school buildings or teacher motivation, improving their pedagogy. Should we focus on those things? In an ideal world, we would focus on all of them, right? But as I said earlier, there is limited time and limited funding, and so we probably shouldn't. So the question is, what should we do? Well, to choose between seemingly good program options, one option is to pair local knowledge and local conditions with rigorous evidence from around the world to inform the design of your program. So for example, even though we have a lot of evidence around how effective some of the demand and supply interventions that I mentioned earlier are, they may not all necessarily be effective in your own context. So for example, you might find that your teachers are coming to school, the school buildings exist. You may not want to make the decision to have another school input, like let's do another textbook or distribute laptops. You may want to think to yourself, perhaps I should consider some of the demand side interventions that we know to be effective. Perhaps we should be providing parents with information about schooling. So it's just about thinking, knowing what works globally, but thinking a little bit more locally about which of these are relevant for my context. And so that's one way to address this dilemma, by pairing this global evidence with what we know about our local environment to decide what is a good solution. And now once you've chosen a set of programs, so let's say you have taken an evidence-based approach to choose a program or a set of options based on the evidence, how do we know that it actually works in your context? Because that's a separate question. And so one thing you could think about doing is using data and impact evaluations to first test different solutions and see whether they've had the intended effect. If in your state you decided that you wanted to provide information to parents, for example, and you did that, it would be useful to test that and see, on receipt of the information, did this actually change parents' decision-making about education and enrollment? Once we've tested these and we've seen if they've had the intended effect, we may want to compare different solutions, especially in terms of their cost effectiveness. So we want to know not just what works, but what is cost effective. Something could work, but it's so expensive and maybe possibly unsustainable. So we want to compare different solutions and think about what is the cost and the impact I get as a result of spending that money. And with that information, we want to scale the most cost-effective solutions. And I think that you would see now that it's becoming a bit of a cycle, because we started out thinking, how do we decide between lots of good options? And when we have found a good option, how do we know that it works? And so I hope that now you're beginning to see that there's a bit of a cycle happening here. So I want to introduce you to a useful way of thinking about this, which we call it JPAL, the learning cycle, which is really trying to encourage decision makers to incorporate evidence at each stage of decision making. So it starts with phase 1, which I mentioned earlier, in the diagnosis and design phase. And here you want to identify and diagnose the problem. Why is it that girls are not coming to school? Why is it that they're dropping out? Why are they enrolling but not attending? Like, what is causing this challenge? And then based on that, looking at the evidence and trying to adapt or design a program. And so here we're really looking at evidence as a way to inform program design. Once we have our program, we may want to look at phase 2. As I said, it's one thing to have evidence inform the design, but another thing to ensure that it's having impact. So in phase 2, we want to think about evaluating and learning from our implementation. And so here we will implement and we will evaluate, but importantly, we need to analyze and interpret the results amongst the broader evidence that we're seeing. So if an intervention worked in my state, how does that compare to how it worked in other states? So if it didn't work in my state, why didn't it work? Which other states or other countries face this problem? So really trying to interpret your results and what that means. And so here you'll see that we're really trying to use evidence generation or learning more about these programs and more about the impact that they make. Which brings us to our last phase, which is around decision making and dissemination. So now we have an idea of whether these programs are having the intended impact, and we need to make decisions about scale. So should we scale up this program because it's working? Should we scale it down because it's not working? And I think that these are some of the ways in which, if we are very intentional about creating data, we can actually on how people have done this better. Let's incorporate that, let's try it again, let's test it again. And so you'll notice that this is really trying to get you to think in a very systematic way about what works, what has worked, what could work here, and whether it worked. And so I'll give you an example of how this has been done in one particular instance. And so this is around deworming. So you may have heard of deworming interventions, which have been shown to improve school participation and performance significantly. I'll show you how it went from Kenya to Nigeria and went from thousands of girls to millions of girls using something similar to this cycle that I've been talking about. So in Kenya, in the late 1990s, there was a public health crisis that was affecting school attendance. So a lot of kids were not attending school because they were sick. And so they partnered with JPAL and our affiliated researchers to try and understand how effective deworming children in schools was. This is research that has been going on for years and years. As I said, this started in the late 1990s. Even till now, we have data about the impact on these same students even 20 plus years later. Some of the things that they found from the research was that, of course, it reduced serious worm infections by 61%, but importantly, it reduced school absenteeism by 25%. It also increased girls' secondary school exam pass rate by 9.6 percentage points. So girls were actually doing better in school as a result of this intervention. Until date, deworming in schools remains one of the most cost-effective approaches to reducing absenteeism. So we know already from the data that you get almost additional 12 years of schooling per $100 spent. So this is something that we know to be very effective, and we only know this because of the research. So using that research in Kenya, they decided, okay, this is a great program. We've evaluated it. We know that it has impact. Let's scale. So in Kenya, they went from thousands to millions of girls. So 58 million children in Kenya started receiving these deworming pills at school. Once it started getting scaled up in Kenya, everybody started hearing about the research and were quite excited about it. A lot of funding started coming in. And so other countries started to think about, could this work here? Do we want to adapt this for our context? And so I hope now you're beginning to see where we are on the cycle. And so thinking about taking global evidence, but making it practical and useful for your local environment. Some piloting was done in several countries, including Nigeria. So they wanted to pilot this deworming program and adapt it for the Nigerian context. There was some funding that came in, and they started in Cross River State, and they reached 600,000 school children in the first pilot. They really tried to understand, can this work here? How would it work? And so they learned a lot from that process. They realized that it was successful, and then it got even bigger, to the fact that 24 million children across 5 different states were now receiving this deworming intervention. And so again, we went from pilot in Kenya to scale in Kenya to pilot in Nigeria to scale in Nigeria. And so it's really just an example to show you how having the evidence, first of all, making sure you're using evidence to make the decision, but also evaluating what you're doing before making decisions about scale can be useful. And now we have all these lessons from the scale work that was done in all these countries, and it's influencing policy decisions about school interventions and health interventions everywhere. But maybe just to sum this up and to bring us back to Suhelia, Suhelia is an individual, but I think that from her story, we could think about systematic change through the tool of the learning cycle. So Suhelia's success is not a coincidence. It was a product of a targeted and evidence-based intervention. And even though it's one story, it reflects a broader truth. The fact that evidence shows that programs such as Safe Space and life skills training significantly enhances outcomes for millions of girls. We have the data about the impact of life skills training, especially on education outcomes. But the point is, without a systematic approach to identify, replicate, and then scale these kinds of successes across Nigeria, how do we make sure that we're going from one Suhelia to millions of Suhelias? And that's where the learning cycle comes in. It really gives you that systematic way of thinking through what actually works here and how do we make sure we're scaling what works. And so why should you be doing all of this? And I think the first thing is saving resources. We are all feeling the real pressure on funding right now. There are funding cuts here, there, and everywhere. It has never been more important than now to be efficient with our spending. And so adopting the learning cycle allows you to use evidence to choose programs that work and make sure you're not spending more money on things that will not work. The minute you evaluate and find out it doesn't work, you want to scale that down. You don't want to spend more money doing something that doesn't work. So it's really important to adopt this systematic approach to save money, which we all know is much needed to save. And then number 2, it leads to better program outcomes. If you incorporate evidence systematically into your decision making, you're going to be implementing programs that have a much higher likelihood of success. And lastly, having this learning cycle or adopting this learning cycle also tries to ensure long-term success. Because if you can scale something based on evidence, then it means that it's going to be more sustainable. And by constantly learning, you're allowing for continual improvement, not just in your interventions, but the outcomes that you seek. Okay, so I'm hoping that at this point, we all see the value of having a systematic approach. But practically speaking, what steps can sub-governments take now to institutionalize evidence and scale proven solutions? I think one point is to just start small, start where you are. Identify one program or challenge that you can evaluate in your state using the learning cycle. Number 2, dedicating resources. So ensuring that there is funding, that there is staff for high quality impact evaluations of your programs. Number 3, think about institutionalization. So how do we embed the learning cycle into policy making processes? How do we ensure that if we incorporate evidence or we do one evaluation, it's not a one-time decision? How do we make sure that this is a new culture that we are adopting in our states, that we are promoting in our states? There are organizational units that you can set up, such as embedded evidence labs, and you can talk to us about that later. But these labs are really one way or one way that setting up this organizational unit can help you to institutionalize these processes and they don't become one-offs. And then lastly, collaborate. this work is huge. It requires a lot of resources. It requires a lot of thought partners. Collaborate. There are so many organizations who are willing to think together with governments about how to do this work well. Partner with researchers, partner with organizations to evaluate your programs. And with that, I'll end with talking a bit about what JPAL does, because we are one of the people that you can partner with. So JPAL's mission is to reduce poverty by ensuring that policy is informed by scientific evidence. So we can help. And there are 3 ways that we support partners. Number 1 is around research. So obviously I've spent the last 20 minutes talking about the importance of evaluating. So of course we will support this evaluating work. So 2 of the main ways that we support research is we fund innovative research into new areas and interventions. But we also connect you to researchers within our network to deliver these impact evaluations, to help you design and implement these evaluations. And then secondly, we also try to inform policy and practice. So we build partnerships with decision makers, with governments, with organizations to inform decision making about program design. So we don't just want to help generate the research and the research is just sitting there. We want to make sure that we are helping partners to use this research in a way that is relevant to their context. So we do a lot of technical assistance, we do a lot of evidence dissemination to make sure that we're able to do that. And then lastly, we do education and training. So we do a lot of capacity strengthening to help partners understand not just how to use evidence, but also how to conduct these impact evaluations. And so it's a pretty interwoven set of activities that we do with partners to ensure that policy is informed by evidence. And we are quite an old institution, relatively old. We just celebrated our 20th birthday, but all to say it's been 20 years of evidence and impact. We estimate that we have reached 600 million people, because to date, over 600 million people have been reached by programs that were scaled up as a result of evidence that came out of evaluations that our researchers did. And so this is really what I mean about let's figure out what works, let's do more of that. And in so doing, we've reached over 600 million people in the last 20 years. And so if you want to talk about any more of these things that I've raised, do come and visit us at our booth or find me around, or my colleague Temidire or Zayad. You can find us in the foyer. And I hope you have a great rest of the conference, and there's a lot more scale-ups coming out of this.
It's another round of applause for her. Thank you so much, Primrose at Jepong, for that session on quality education through evidence-based data generation, the roles of subnational governments in Nigeria. Without doubt, we know that we can't do much without data. So this session is very important, and like she said, you can always meet her for further conversations if need be. We are going to be going into a question and answer session. I'm sure that a number of us in the room have questions, comments, contributions from the 3 sessions we've had since tea break. So this is the segment where you'll be able to ask your questions. And I want to invite Professor Muhammad Junaid from Usman Danfodio University, Sokoto, to moderate this question and answer session. Please put your hands together for him as he comes up. If you have your questions, you can put it together and you'll be given an opportunity to ask. Thank you.
Good afternoon. We've just listened to a single presentation on data. There was supposed to be another presentation on data generation and inclusive education. But I guess maybe the presenter is not around. So we have 30 minutes for questions and answers on the last presentation. And I'm ready to take any questions. By show of hands, please, if you have. Nobody has any question? Why is the last presenter? I think you need to come up on stage to respond to any questions that may be asked.
Good afternoon. My name is Odue Iyembe Faustina, a student of Government Secondary School in Gwagwalada Area Council. My question is channeled to the panel that discussed on the Agile presentation. Now, the question is, I would love to say I am actually happy to see that there is a corporation or an organization that is already taking care of the fact that some girls are out there that are not ready to learn or were not opportune to learn. And there is a corporation that wants to forward that into a great mission. Now, my question is, how can teachers improve the mental health of these girls and their physical participation in the school? Because there are some of these girls, before they make their decision to come back to school, they went through mental challenges at homes and other things that might disturb them, that even if they come back to the school, they will feel challenged in class in several things.
I'll take more questions.
Thank you very much. My name is Shukrat Temitokwe Ibrahim, a corporal representing Gombe State, which happens to be the eastern part, the northern eastern part of Nigeria. Now, talking out of my experience and things I actually observe in Gombe, Gombe actually happens to be one of the states in Nigeria who the government is really trying in terms of education compared to other parts of the north. But in as much as the facilities for schools is being provided, it saddened my heart personally that the children or the students do not go to school as expected. You see them going to school at 9 a.m. and once it's 12, they return back home. They tell you they are going for farming. Now, another thing that surprised me most is the fact that most of these people do not even know how to speak correct English. Once you are in this part of the Nigeria, once you can speak Hausa as their native language, then you're definitely going to have language barrier. How can we help this situation? As an ambassador representing Gombe State, of course, I'm Yoruba by tribe. How do I want to communicate to these people, even when they do not understand the basic English? So what can we do in order to help these people that do not even know how to speak English? Thank you very much.
Please, can we direct our questions to the presentation that was made? Let us talk about data generation, and it relates to quality education, which I think is the focus of the presentation. So if anybody has questions on the presentation, because the presenter is standing here and she's ready to respond.
Yes, thank you so much.
Yeah.
Dr. Imam Bello is my name, principal in one of the senior secondary schools.
Good.
I sincerely have to appreciate the presenter. Honestly, it is a well-researched document. I sincerely applaud your presentations and with all the evidences shown. However, these data are very good. But I want to suggest that if it is possible, let there be a synergy between the schools, you know. Let there be a system where there will be collaboration, you know, at certain intervals. These data should also be reviewed. Maybe let me use my state for instance. Annually, termly, we normally have our school statistics. And that statistics is a robust document that covers every aspect of the school program. And if this information could be shared and these data are also interconnected, we'll be able to see how does it operate in one other place and how can it improve, you know, in areas where there is need for that. So I just want to advise that maybe if there will be synergy so that we can be able to know. And then if the framework, of course, maybe the tools we are using to generate our data, you know, through sharing of these ideas, we will also be informed, you know, of other tools that could help, because data are very necessary for development. Thank you so much.
So if I may
Another
ask,
question for her, please.
okay, all right.
Good afternoon, sir. Good afternoon, ma. So my name is Sonny Titilokpemi, a representative from Akwa Ibom. Okay, yeah, it's very related to sir's observation or question. I really want to know how, before a data can be reviewed, it has to first be collected. Now, looking at how large a state could be, different schools and all of that. So I'm really more particular about how do I, as an ambassador that is really interested in knowing what has worked or what has been done previous times and comparing it to know, okay, what program am I going to design or what step am I taking now? So how do I really collect these data, knowing that the state is large? How do I get this data collected before it can be reviewed?
No, I wanted to ask the principal, how many types of data do you keep in your school? And by that I mean, sometimes you have data for government.
Yes.
You have a different type of data for development partners. Huh?
Is it possible, sir?
So how do you reconcile?
The school is government school, and government, of course, you know, collect the data. We collect the data for government. So development partners, what I mean is, of course, should synergize too, so that where these data are collected, you know, we are all aiming at, you know, improving the whole system, most especially data that has to do with girl-child education.
Okay, thank you. Any more questions for the presenter? Yeah, thank you. Well, if we don't have any more questions from the floor, I think I would like to invite our noble presenter to respond to some of the questions that were asked. And after that, we will ask the agile presenter to respond to, I think, one or two questions that were asked on her own presentation. So, please.
Thank you so much. Even though the first question wasn't directed to me, I do think there's an interesting piece of evidence that might help to expand your thinking around that further. So somebody asked about how teachers can support the mental health of students. For example, that's one area where there definitely needs to be more research. However, we have existing research about the power of peer support. So yes, I think the teacher has a role to play, but we've seen from the evidence in a lot of life skills programming that one of the things and one of the ways through which life skills works is through social bonds. So the fact that girls can be in these groups together, talk about their problems, whether it's at home, whether it's bullying in school, whatever it is, the fact that they have this community to share problems with, take advice from others from, and not feel alone has been one of the main ways through which life skills programming works. So all to say, there's a role for peers to play even when it comes to mental health. That's not to say there's nothing teachers can do, but I did want to just highlight that aspect as well. I think the principal asked a question around how do we consolidate all the evidence that different schools and different states, etc., are taking. I think that's an excellent point. I think I can speak to it from the perspective of why it's needed. The stronger the administrative data we have, the cheaper it is to collect data and to evaluate programs, and the quicker it is. And if we can make research quicker, easier, and cheaper, then it's even easier for us to adopt the learning cycle. So the only thing I can add to your comment is to profusely agree with you and make a case for why it's necessary. I think there was a question also around, one of the ambassadors asked how you can, being an individual, how do you collect data on what works? I love that question because I think that it raises so many ways that we think. The first thing I would say is, so there are places you can go to find what works. It may not be what works in Akwa Ibom, but it will be what works globally or what has worked in other places. And I think the really critical point there is we don't need to have research just from our place for us to use the research. If something has worked in India, it doesn't mean because India is nothing like, or a state in India is nothing like Akwa Ibom, we can't use it. We have to ask ourselves, why is it that that program worked in India, and are those conditions the same as the conditions in Akwa Ibom? So what is beautiful about a lot of the impact evaluations that are being run is that they give us information about why something worked. So it's not just about saying this was evaluated in this place, it's different from here, so we can't even touch it. It's about drilling it down to understanding why did it work, and will that particular thing work in Akwa Ibom? So I can give you, you can come chat to me later, I'll give you a lot of resources where you can find data about what works. And then I would also just challenge you to reorient your thinking around not thinking like you can only use data from your state, but that there are ways to think about how data from other places can be relevant in our state. Thank you.
Thank you. We now invite the Agile presenter to respond to our questions.
There are more questions here, sir.
No questions?
More questions here, sir.
No or more?
More, M-O-R-E,
Oh,
more,
okay.
sir. Yeah.
All right, so more answers are expected.
Thank you, sir. Good afternoon, everyone. I'm Mrs. Abuka. I'm the Deputy Project Coordinator of the Agile Project. Just to support my coordinator, I can't remember very well.
The question is, how can teachers improve mental and physical participation of students? And also, how can they help their northern students who cannot communicate in English, who spend less time in school and have to go back to farming?
How to go back to?
They spend less time in school because they have to go back to the farm. They get to school at 9 a.m. By 12 noon, they leave school and go to the farm. How do they help them? How do they support them? Especially that they also don't speak English. But I think the other question is the mental and physical participation of students.
Okay, like the normal school program and with the Agile coming in to support students in secondary school, we have this sub-component that deals with life skill. And in the sub-component, we have this safe space session where the students come together after school to sit down and discuss issues with them. So during that session, we discuss all this. They feel free to discuss personal issues that affect them. And because it's a safe space session, they sit down in group, in circle, with a facilitator. We have them specially trained, they are guidance counselors. They advise them. If it requires even having a one-to-one discussion with them, you know, they do that during the safe space session. So those that have emotional problems, they feel very free to talk with the teachers or the guidance counselor during this session. Like it helps them in communication skills, it helps them in developing a lot of skills that help them to navigate through life. So it is a very serious component of the subcomponent of the Agile project that we take very, very seriously, so that children will be able to come out of their emotional issues, because we have many of these students going through this emotional problem in school. And that is why, through research, the Agile project was conscious of this before the project started. And it's something that we are doing seriously to address helping girls to come out, to develop, you know, this strong will, personal will of living life. And it is helping a lot. Sometimes some of these students that participate in this life safe space session, they go out to tell their peers in the community that they are really enjoying the session. And through that, we have success stories that some students who dropped out of school came back to tell us that they want to register because they want to participate in these safe space sessions. So the Agile project is doing a lot on this. Thank you. Have I any other?
So, Ma, the question on the language barrier that our student ambassador from Gombe asked, is Agile doing anything to support in that area?
Well, that for students that cannot speak, that goes to the second chance component, and it has just been introduced into the Agile project. It's coming with the additional financing. We are working through mass education to teach these students basic literacy and numeracy. So that is a new component that has been introduced into the Agile project. So if there is need for this, then the students have to participate in the mass literacy sessions to be able to learn basic reading and writing skills. I think that answers the question. So the Agile project is working in this area, in that direction.
Prof, can I take more questions from the students? Thank you.
Good afternoon, everyone. My name is Jennifer Dangbe. I'm a student of Government Secondary School, Dobi. Please, I want to ask, why is it that 99% of the students, I guess, that are not allowed to go to school, not boys.
Good afternoon. My name is Amina Bakar. I'm from the Planning and Research Department of State House. The Agile, I don't know if they intervene in these private schools. Those days when we go to school, the books that the students use, the younger ones who use in class, who go to class 2, the class 1 will use, class 3, class 4 will. Now, every term we are forced to buy new books, which is giving parents problem. It's not as if there's money now. Everybody knows the economic situation. For God's sake, Agile should intervene. It's overwhelming parents. Thank you so very much.
I'll take another one here.
Good afternoon. I'm an ambassador representing Kogi State. But I want to ask a question concerning the vocational skills. Many of these girls actually don't like coming to school because school doesn't help them, teach them skills. And we're supposed to have a vocational skills. Now, I'm actually opportune to serve in a secondary school. And I found out that history is not part of the syllabus. Now, history has been scrapped, and I was thinking vocal skill could be included in it. And I found out that it's not included, and there are so many courses that can actually help the girl child, to educate the girl child, and all those courses are being scrapped out. So I want to ask if this vocational skill can actually be added to the scheme of work for the school, because the private school are seeing those courses as courses that is unnecessary. And I think federal government should actually put a committee in which that would actually check the scheme of work, and most importantly, the vocational skill, because so many of them are so poor that their fathers cannot take them to school and still come back home and look for money to take them to go teach them training and all that. I think school should actually cover all these aspects. It's part of education too. Thank you, ma.
Thank you.
Prof, should I take the last question?
Okay.
Last question.
Thank you. I want to speak from the point of view of a teacher and a school administrator. We talk about the gay child education. And I do know that the gay child education is faced with quite a number of social vices having to do with the issue of bullying. Bullying, of course, takes place in the school system. It takes place even on the way from school to home and from home to school. Bullying affecting the gay child equally takes place in respective families. The one that takes place in the school system, I know as much as school administrators can do something to ensure that the gay child enjoys her education. We know that even among students, the classroom situation, there are bigger ones who bully others. And we also know that in the classroom situation, boys who are physically stronger bully the girls. But what always amazes us is a situation where a child is being bullied either by a guardian or by a parent. In the school system, school administrators are doing as much as they can to make sure such problems are tackled. But the one that affects parents, how do we do that? Because there are some parents, you invite them to school, they come, some don't come. And so those who don't come, what do we do to ensure that such problems are tackled. Thank you.
To tackle such problem, to me, since the parents have they have their children in the school, we can kind of impose the sanction on the students so that we can get the attention of the parents, like those that refuse to, comply with certain rules and regulations. Through the students, we should be able to get the parents to respond and probably give the necessary sanction. And I think it will be obeyed if you want your child or your ward to continue to be in that school. I think that can help. Then there's a question that was asked. We have trade subjects in the schools now, these days. We have trade subjects in our secondary schools. I don't know, I don't really understand what you were saying. We have trade subjects in secondary school, the vocational subjects, which are being taught along with other subjects. So that provision is there already. Then that girl that asked one question there, I didn't really understand your question.
She said 99% of girls don't go to school. What do we do? How can Agile help to ensure that girls also go to school and not just boys only?
All the intervention that is being provided by Agile is geared towards attracting them to school. Like we have talked about improving security, we have talked about providing wash facilities to make the school environment conducive for girls. Like we know there are many schools, we went around the schools, even as we are implementing Agile. There are some schools that they don't have toilet facilities at all. Like Agile is providing this intervention in all the government secondary schools in any state that we are intervening. All the government schools, no exception. It's just that we don't go to private schools. It's limited to government schools, government secondary schools. So all these facilities, all this intervention is being provided so that the girls can go to school. There is conditional cash transfer that Agile is providing for the poorest household. We kind of carry out mapping to be able to identify children that come from very poor homes. And the funds are given to them to ease the poverty level of the various families that are identified, to encourage them to go to school. And as we continue on the implementation, we try to do a kind of follow-up to ensure that those that don't come to school, we try to follow them up to their homes to ask what are some of the reasons for not coming to school. And through this, we're able to bring some of them back to school, those that have issues. Like I said, the guidance counselors, they bring them very close and try to help them to come back to school. We make the school, the Agile project, try to make the school environment very conducive. Like, during the menstrual cycle, the period, some children, through research, don't go to school because they don't know how to handle it, especially children from very poor background. But the Agile project tries to ensure that there is always water. Then some states, they even provide sanitary pads for the children, like Katsina State, I know. for the children in school and all those. A lot is being done to encourage students or children to come to school. I think that's that.
Thank you.
Thank you.
There's also a question about recycling books. You know, buying books every term, every year.
In private
what
schools,
can Agile do to help?
That I don't know how to answer that. Agile, yes, we provide instructional materials, but just like I told you, that the operation of Agile is limited to government school, because she was talking of private schools. Maybe from the ministry, we'll try to take it up to address it with the private school owners, and I think that is what we can do from the level of the ministry, because we have some sort of control over the private schools to talk with them on issues like this, and that's all. Thank you very much.
I think we are done with this session. So I would like to... Okay, so please, another round of applause for our two presenters. Thank you very much. I hope I'm not the only one that missed lunch.
We're going to have lunch very soon. Professor Mohammed Junaid Usman, Danfodio University, Sokoto. Thank you very much, sir. Please let's put our hands together. And as we will be wrapping up, I'll call for the vote of thanks, just for you to know that we're going to have lunch. But I just quickly want to seize the opportunity to thank the Rivers State government, the World Bank, and the Nigerian Governors Forum for the International Conference on Girl-Child Education in Nigeria, Day 1. Tomorrow we will gather here by 9 a.m. It's Friday tomorrow, but we will gather here by 9 a.m. and some of the sessions that we couldn't do today, we will do them. So I'm seizing this opportunity to please appeal that we get here on time so that we can get going with Day 2. At this point in time, for vote of thanks for today before we go for lunch, Dr. Abdulateef Shitu, Director General, Nigeria Governors Forum, who is ably represented by the capable Dr. Chineku Ore. Thank you.
Distinguished guests, esteemed partners, ladies and gentlemen, on behalf of the Nigeria Governors Forum, I extend our deepest thanks to His Excellency Kashim Shettima, the Vice President of the Federal Republic of Nigeria, for his esteemed presence at the auspicious event. His Excellency's dedication and commitment towards advancing girl-child education in the country is reflected by the commitments of this administration to ensuring that no child is left behind. We would also like to appreciate the Rivers State government and the World Bank through the Adolescent Girl Initiative for Learning and Empowerment, Agile Project, for their invaluable partnership and sponsorship of this conference. I also wish to acknowledge all our other partners for their steadfast support and goodwill, which have been instrumental to the success of this event. To all our guests and distinguished participants, we are equally grateful for your esteemed presence. Your participation, active engagement, and contributions, both from within Nigeria and out, underscores the strengthened collective resolve and global commitment to advancing girl-child education in our country. The Nigeria Governors Forum remains steadfast in its commitment to education financing, particularly at the basic education level within the states. girl-child education remains our foremost priority. And to achieve inclusive education nationwide, our primary school enrollment drives, underpinned by the Education Community of Practice framework, are crucial in promoting quality education and fostering national sustainable development. Once again, we want to thank you for being a part of the maiden edition of the International Conference of Girl-Child Education in Nigeria. We look forward to seeing you tomorrow when we will wrap up this conference. Thank you.
And on that note, we would like to specially thank those who stayed throughout from the beginning till this end. Thank you very much. And this marks the end of day one of the Nigeria Governors Forum International Conference on Girl-Child Education in Nigeria. And my co-master of ceremony,
we want to just say thank you to you for staying put with us till the end of today's program, and we look forward to welcoming you bright and early tomorrow. And my name remains Dr. Chineku Ore, and I hope you'll enjoy your lunch.
and we would also like to thank our sister, Jimin Victoria, who has been here all day with a sign language interpretation. Thank you very much. I remain Tom Okewale Shonaya. Thank you so much. We'll see you tomorrow, 9 a.m. God bless Nigeria.